Today we are covering pain assessment and management, a critical topic for the NCLEX because it tests your ability to prioritize and act on the fifth vital sign. The exam will give you a clinical scenario and expect you to know how to assess the patient's pain accurately and what to do about it. The most important rule to remember is that pain is what the patient says it is. An exam question might describe a post-operative patient with stable vital signs who is quietly watching television but reports an 8 out of 10 pain level when asked. The trap is to dismiss their report because of their behavior or normal vitals. The correct answer will always involve believing the patient and taking action. You must treat the self-reported number. A key part of assessment is using the right tool for the right patient. For a communicating adult, the 0 to 10 numeric scale is standard. But what about a 4-year-old child? The NCLEX will expect you to choose the Wong-Baker Faces scale. For a nonverbal patient, such as an intubated adult in the ICU or an infant, you must use an observational scale like the FLACC scale, which stands for face, legs, activity, cry, and consolability. Don't just know the names, understand who they are for. When it comes to pharmacological management, especially opioids, the exam is all about safety. Your number one priority assessment before and after giving a dose of morphine is the patient's respiratory rate. An answer choice related to preventing constipation is a valid nursing intervention, but it is never the priority over assessing for respiratory depression. A common exam trap involves a patient with a known history of substance use disorder who is now experiencing acute post-surgical pain. The wrong answer, and the trap, is to withhold opioid medication due to fear of worsening their addiction. The correct NCLEX world principle is that a patient with acute pain deserves effective pain management, regardless of their history. Your duty is to treat the pain. Remember the mnemonic PQRST for a complete pain assessment, which is a great mental model for deconstructing exam questions. Ask yourself what the question tells you about provocation, quality, region, severity, and timing. This framework helps you identify what information is crucial. For example, if a question describes chest pain that radiates to the jaw, the region and radiation part of your assessment immediately signals a potential cardiac event, making it the highest priority. Finally, consider end-of-life care. The principle of double effect is often tested here. If you administer a high dose of morphine to a terminally ill patient to relieve their air hunger and pain, and their respiration slow down, your action is ethically and legally justified. The intent is to provide comfort and relieve suffering, which is the primary goal. The exam will test your understanding that providing comfort at the end of life is the priority, even if it inadvertently hastens the dying process.